All right, today I'm privileged to share with you boosting your child's immune system. And this is a topic which is very relevant now with the COVID-19 that's disturbing us for so many months. All right, so the immune system is a very important system because if you are not a strong person, you will fall ill, and even you have the best of brain, you cannot use it properly. So that is why we focus on the immune system, right? And the immune system of a child must be balanced because too much and too little is also bad. If you have not enough immune system, your immune system is weak, then you're prone to infections. If you have an overactive immune system, then you will go the other way around, then you get autoimmune diseases and allergy problems. Now, so what affects your immune system? Number one, it is your gene, your genetic makeup, what your parents give you. And after that, it is influenced by diet, what you eat, what you put into your gut, and how you control the environment. So the immune system is important, and a child at birth is very at risk of infection, inflammation, and hypersensitivity, like allergies and like asthmas and rhinitis. So the most common respiratory system we see will be respiratory tract and gastrointestinal tract. These are the infections we see a lot in our clinic. So you get viral infections, bacterial infections. So when you're weak, you get infections. When your immune system is overreactive, you get allergies like asthma, eczema, rhinitis. And of course, you've heard of this thing called autoimmune system. When your immune system is overreactive, you get things like Kawasaki disease, SLE. And in the COVID period, you get this thing called the cytokine storm, and you go into severe immunity overdrive and actually succumb to the immune system, and you die from Kawasaki disease and severe respiratory problem. So overreactive immune system is also not a good thing. So we have to balance it. So number one is your gene, all right? So we are given by our parents. So you cannot choose that. So you inherit it from your parents. So your mom or your dad, if they happen to have some genetic problem, congenital immune deficiency disease, it can be from mom or dad, or it can be sex-linked, it can be combined. So one or two person may have a part of the gene, and when they combine together, the child get very severely affected. So this kind of diseases, you don't know sometimes until the child is born. But sometimes you are aware of it already when, as a couple, and it's good to let the parents, the doctor know, because once we are aware of it, then we will know how to modify it to avoid diseases. So we have to change your diet, change the environment. So advice can be given along the way if you're aware of what genetic profile you're in. So some of these diseases like asthma, rhinitis are also inherited. If your parents have history of allergy like rhinitis, eczema, again, this can be transmissible to the next generation. So genes is inherited, but you try to modify it by your diet. So diet is what begins from the time mother conceived the baby. So the diet that mother consumes is very important. If the mother has a healthy diet, if the mother has a healthy lifestyle, then the likelihood that the baby is healthy is greater. So number two, how the baby is delivered, the choice of delivery, be it via vaginal delivery or by C-section, again, that will alter your intestinal microbiota. So the intestinal tract, that's what I call the gut. This is a very important organ that controls our immune system. And 2/3 of our immune system is packed in the intestinal tract. So they contain important organisms. We call it microbiota. We'll talk about probiotics. We'll talk about bad bacteria as well. So how the delivery is will influence the microbiota of the gut. Subsequently, after baby is born, what sort of diet you give to the baby? Is it breastfeeding? Is it formula feeding? And do you need to alter any of these things? And beyond 6 months of age, what is the diet that you should adopt? All this will control your immune system. And of course, if you are deficient in certain things, the doctor will give you supplements in terms of vitamins or probiotics. Okay, so as I mentioned earlier, the intestinal tract is where 2/3 of your immune system is packed, and therefore it's a very important organ. The intestinal tract is also an important organ. That's where you receive your nutrient, metabolize it, and absorb into your body. So the gut is a very important organ, so treat it with great respect. So apart from the gut, of course, you've got to breathe. So apart from respiration, the next most important organ is the gut. So we have to make sure we prime our gut immune system properly in order to enhance our immunity. So all the immune cells, the epithelial cells, your microbiota, and they develop immunity, and from there it is disseminated into the other parts of your body, goes to the respiratory system, the skin, the nasal cavity, the mammary glands, the urinary tract. So the health and the immunity in the gut will influence the total health of the individual. So what you eat is the most important. So to prime your immune system, you have to eat right. So the mother's health, which I mentioned earlier, the delivery will put into the baby's intestine, and subsequently breastfeeding. Okay, it's healthy mother, healthy baby. That's important. All right, lifestyle and diet. Now, the most important, maybe some of you may not be aware, now how the baby is born will influence the microbiota of the intestine of the baby. All right, so a baby who's delivered by vaginal delivery acquires the vaginal microbiota from the mother, and this microbiota are predominantly good bacteria we call bifidobacteria and lactobacillus. Study shows that baby who's developed by C-section, the microbiota in the gut is mainly pathogenic. Pathogenic means disease causing, and these are E. coli and Clostridium. So sometimes you have no choice, but you listen to the gynae. If really the baby is in distress and has to be delivered by C-section, then certain modification can be done to the baby after delivery, which I'll advise you later. So when a baby is delivered by vaginal tract, as the baby comes out through the vaginal canal, it takes the mother's immune microbiota, and that actually colonizes the intestine. When the baby goes to the mother after delivery or skin-to-skin contact, it also gets a good microbiota from the mother. And when the baby, after delivery, we always encourage baby to the breast, all right? And when baby consumes and suckle on the breast, the DNA and the milk probiotics also goes to the baby. So if a baby can be delivered vaginally, that's the best thing that you can do. But as I said, if conditions does not allow, and if there's a risk to mother or child, and your gynae thinks that a C-section need to be done, please follow the instruction. And as I said, certain things can be modified. Some parents actually request that they take a swab of the mother's vaginal microbiota and give it to the baby after delivery by swabbing the oral cavity. All right, that helps to enhance the immunity as well, and also not bathing the baby immediately. Now, there are studies to show that babies who are delivered by cesarean section, they have a higher risk of allergy problems, like asthma and atopic dermatitis as well. So we will actually modify it by breastfeeding the baby and also supplementing the baby with probiotics after delivery. So these are some of the things that we can do. Okay, so to enhance the immune system of the baby, there are 3 superfoods. One is breast milk, which contains all the good nutrients, both nutritive function and immunological function. There is also the other 2 things which you hear a lot, I'm sure in the media, what is probiotics, what is prebiotics. So today I'll talk a bit about probiotics and prebiotics and help you to understand what these terms mean. Of course, as I said, the most important nutrient after delivery to the baby is breast milk. Okay, now we'll talk about the word probiotics, which I think most of you understand what it is. Now the word pro means for, and the biotics is life. So the word probiotics is actually for life, promotes life. And basically what are they? They're live organisms, microorganisms in our intestine, and they're actually good bacteria, or we call it friendly bacteria. They're naturally found in the person's gut, and they're also found abundantly in breast milk. So breast milk babies are usually abundant in bifidobacteria in the gut. So that is why breast milk is important. So if you are unable to breastfeed, you'll find that the milk company will try to enhance the milk by adding probiotics. Okay, so probiotics means promote life. What is prebiotics? The word pre means before life. Okay, so basically before life means it acts as a nutrient for the probiotics. So it is a food for the probiotics. So if you give food to the probiotics will multiply, and if you give good food, they will multiply even more. So the role of probiotics, we call galacto-oligosaccharide, or GOS for short, and in human it's called HMO, and you find that breast milk contains a lot of HMO. It is the 3rd largest component in breast milk. So you need this to feed the microbiota in the newborn, and the most abundant HMO in the baby, in the mother's milk, is this thing called 2FL. But however, this 2FL is very interesting. The amount of 2FL in different races are different. And the amount of 2FL in breast milk also varies with gestation delivery. After delivery, and into 1 week, 2 weeks, 4 weeks after delivery, you find that the level of 2FL actually changes. So 2FL is present in 20 to 30% of the breast milk. And babies, again, who are unable to, mothers who are unable to breastfeed, then they have to take milk, which is fortified, which this thing called 2FL as the main HMO to enhance the growth of good bacteria in the intestine. So that's the two words, probiotics and prebiotics. So hopefully you understand that. So you look out for this word and look at if you're breastfeeding, it comes naturally. If you're not breastfeeding, if you're looking for infant formula, you will look for infant formula that's fortified with probiotics and prebiotics, particularly 2FL. Okay, of course, I think by now, breastfeeding, answer, of course. More yes, all right, unless you're not able to breastfeed, because breast milk gives you the immunity, and babies who are breastfed, you find that they're less chance to fall sick from both gastrointestinal infection as well as respiratory infection, all right, because of the microbiota. And breast milk has all the nutrients. There are two parts of it. One gives the nutrition, which contains the fat, the protein, the carbohydrate, and help the baby to grow. And the other part is the immune part, which is contain the HMO and the, as well as the probiotics. So if you breastfeed, your incidence of infection from respiratory and GI is much lower than if you are unable to breastfeed because of all the bioactive ingredients in the breast milk. Okay, so it's to be strongly encouraged. All right, so in the first 6 months, the ideal milk to give to babies is breastfeeding. And I'm sure most mothers will know since you are already having 1 child, 2 child, even 3 children. Okay, and it contains prebiotics, probiotics, and immunoglobulins as well. They also contain growth factors. And I'm sure you know that breastfed babies are more intelligent because of the DHA, the choline that's inside the baby mother's milk, right, given to the baby. So breast milk is definitely, study shows that babies who are breastfed have lower risk of gastrointestinal infection, autoimmune diseases, and atopic diseases. So all this is because of the presence of bifidobacteria and lactobacilli in babies who are breastfed. In babies who are not breastfed, you find that the gut bacteria is slightly different, and they basically are more harmful, like Clostridium and E. coli. So when you study the microbiota of babies who are breastfed and non-breastfed, they are slightly different. Okay, so formula feeding, if you're unable to breastfeed, then we enhance them. So you look at this formula nowadays, they're enhanced with nutrients for the brains, like the DHA, the phospholipids, the choline, which is for the brain function. They're added vitamins and minerals. They're added probiotics and prebiotics, especially the bifidobacteria, and also to enhance with this special prebiotic called 2FL. Okay, so this is what you should look out for. So we talk about infection, now we talk about allergy diseases. So if your immune system is weak, you tend to fall sick. But if your immune system is overreactive, then you develop what we call allergic diseases. Allergy is not just having hives or swollen eyes. This is acute allergy. But allergy diseases also include like asthma and rhinitis. Okay? So, and allergy diseases are definitely on the rise, all right? And it is actually very common in children nowadays. Okay, the risk of allergy-related diseases is 1 in 5 children, aged 2 years and above. And most of the allergies appear in first year of life. And how do they manifest? Their manifestation depends on which organ you're talking about. If it manifests in the gut, the very severe acute allergy can manifest with sudden abdominal pain, vomiting, and vomiting can be so bad, it can be blood stain. It can be bloody stools, and these are severe cow's milk allergy. Usually they manifest in vomiting or blood stained stools. If it manifests in the skin, then it manifests as hives or swollen skin, or eczema, which is dry, itchy skin. If it affects the respiratory system, they manifest as wheezing or asthma. And it affects the nose, then you get allergic rhinitis, itchy nose, sneezing, stuffy nose. You get sinus problem, you get headache, you get fever. So that's how they look like. So this is the hives, the baby hives. And it affects the respiratory system. I'm sure most of you have seen in the clinic, people using nebulizer, giving inhaler. This is because we have to treat their asthma. So these are all manifestations of allergic diseases. But the other thing that's very common and on the rise we see is what we call atopic eczema or skin sensitivity. And this is very common in families. If you have a family history and one or other parent or even both parents are affected, the chance of child getting it is very, very high. So 1 in 3 children with family history of eczema will have eczema. And if you have a knowledge that this is so, then it can actually prime you to take certain precautions like after delivery, breastfeed. If you cannot breastfeed, then there are certain milk that I would advise you to take, all right? So most of them manifest in the first year of life. Some of them will outgrow eczema, but some of them do go into school age group. Although 10%, the severe eczema can go on to adulthood, all right? And it's it may not cause mortality, but it causes a lot of morbidity, it causes itchiness, the child cannot sleep, can be scratching, and it can cause excoriation of the skin, and can be blood all over the skin. Okay, so to prevent this, breastfeeding, if you cannot, infant feeding, that's which one to give, and we have to wean, you have to wean with less allergenic food. All right, so breastfeeding for the first 6 months, and alternative, so there are scientific papers that shows that breastfeeding for at least 4 months prevents or delay atopic dermatitis. It also prevents milk allergy in early childhood. So the best is first for 6 months, try if you can breastfeed, all right? Now, so if you're unable to, then the advice from the literature, the medical literature is to use hypoallergic milk. That also reduce the risk of atopic dermatitis in children or babies who are predisposed or with a family history of atopic dermatitis. Okay, so recommendation again, high risk milk allergy in babies, please breastfeed. If you're unable to, then find a milk that reduces allergy by using hypoallergic milk. But some babies, they cannot tolerate hypoallergic milk and it's still not good enough, then you'd have to use extremely hydrolyzed milk. Now, hydrolyzed milk means the protein in the milk is smaller in particle. The normal milk, the protein molecules are big. When you break it down by hydrolysis, by enzyme to break down the big molecules into smaller molecules, the smaller the molecules, the more hydrolyzed it is, the less allergenic it is, right? So the processing cuts down the allergy. The other milk formula that has been suggested to cut down allergy, soy milk, goat's milk, is there a truth to it? Again, study shows that it is not proven that soy or goat's milk cuts down allergy. The answer is still hydrolyzed milk, partially hydrolyzed or extensively hydrolyzed to cut down allergy. Why goat's milk is not the answer? Because they're like cousins. Cows and goat are like cousins, I always tell my parents. They share 90% of their protein. So 90% of children who are allergic to cow's milk are also allergic to goat's milk. So the alternative, we have cow's milk allergy is not goat's milk, okay? So there's no studies to show that goat's milk reduces cow's milk allergy. Okay, then how, besides all this diet modification, of course, you have to modify your behavior, all right? To modify your behavior, hygiene is important. This time of COVID, you're told to wash your hands, wear a mask, use hand sanitizer, and this is important because simple hygienes will cut down your risk of infection. And of course, vaccination is very important. So now they're trying to create a vaccine against COVID, but there are many vaccines that are presently available. Try to go for all these vaccines. Do not be so afraid. There are no reason that vaccines that are approved by the medical profession can cause harm to you. So you have to protect against measles, you got to protect against influenza, follow the regime that the Ministry of Health recommend, and go ahead and catch up with vaccination if there's any delay. Okay, so hand hygiene, washing, sterilizing your milk bottle. I think most of you knows that, all right? So we are very successful in controlling tuberculosis. In fact, there's no more smallpox and therefore no more smallpox vaccine. Smallpox is eradicated just by vaccination alone. And because smallpox is no more available, no more a disease, we do not offer smallpox vaccination. But people may keep it as a biological warfare. Okay, so do get your children vaccinated to prevent diseases. Now, as a child grows, after the first 6 months, from breast milk to hypoallergic milk or extremely hydrolyzed milk, from weaning diet, you have to avoid allergenic foods if you have family history of allergy. And because you have an allergy problem, it will worsen the immune system. So these are the top 8 allergenic food in the market. So I'm sure you know about wheat, cow's milk, eggs, peanuts, tree nuts, fish, especially shellfish, and soy. These are very common allergens. And if you are unable to know what it is, so you have to go trial and error. This is the food. If you take it, you develop rashes, you get eczema, you get stuffy nose, avoid it. So we call it by challenging the food. But after you've experienced the food and it causes allergy, there's a test that can be done. We can do a skin prick test. We can do a blood IgE test to find out whether your child is allergic to certain food and food avoidance. So that's allergenic food. But besides allergenic food, there's certain food which is also bad for your body. We call it toxic food. And toxic food would be things like acrylamides. When you cook food by deep frying, by barbecuing, they contain acrylamides. You take processed food, again, that's bad for your baby. So taking the right food is also very important. It's not just allergenic food. So how we consume our food. So we avoid trans fat. Everybody knows what's about trans fat. So we minimize trans fat. Try to take non-polluted food. We advise to take food as organic as we can. And we try to take omega-3 fish oil, which actually cuts down inflammation. The one that's omega-6 are actually the nuts. The nuts oil are actually omega-6 oil. So we try not to take too much nuts oil, but we advise you to take olive oil and fish oil and sesame oil. Okay, so avoid toxic food. Avoid additives, avoid the way you cook. Steaming is better than deep frying. All this modern food, we strongly discourage them to be given. So maybe you may want to give it to once in a while to the children for parties, but these are not to be encouraged. Even juices is something we do not encourage parents to give to children too much, because to get a glass of fruit juice, you probably have to squeeze a few fruits to get a glass of juice. So the amount of fructose which convert to glucose is too much. So taking juice is actually not a good habit. It is a better habit if you give a child fruits as a whole. Because when you take fruits as a whole, it makes you full. You don't take so much of it. And when you take fruits, there's also fiber. And fruits has good soluble fiber. It's also good for the gut. It makes the stool soft. So people who are constipated, we always ask them to take fruits, not the juice, all right? Because when you juice, you remove the fiber, you're just getting the sugar. And getting too much into one glass of juice, the fructose and glucose content goes up. So obviously, deep frying, all the chips and fries, all the barbecuing, all this cause trans fat, and acrylamides increases the risk of cancer. Okay, so this are not encouraged. Processing food and deep frying. Now, besides food, allergic food, toxic food, the nurture is very important. So how we bring our children, because all this combine to make a child healthy. So the diet and the environment, how you is nurturing, because sleep is very important. So a child needs to sleep to catch up with the strength, to be recharged, to be able to active again the next day, to play and to go to school. Now the other thing is, when a child sleeps, that's when the growth hormone secretion comes in. So I usually advise parents to let the child sleep by 9 o'clock at the latest, because when you sleep early, your growth hormone secretions peak at about midnight, 11 p.m., 12 p.m. And during the sleep cycle, as the growth hormone secretions get more, that's when your child grows better in length and in health, all right? So sleep is very important. So make sure baby have the proper sleep. The environment is not too noisy, not too much rowdiness in the home from TV or whatever's around in the house. Okay, so a warm, happy environment, a good household is very important as well, because when a family is united, is loving, there's a good hormone we call oxytocin. And oxytocin actually boosts the immune system. A family that is not in harmony, a lot of shouting and screaming, it will cause a lot of poor sleep in the child, because the stress hormone to go up, and the stress hormone increases cortisol. The stress hormone actually causes high blood pressure and diseases. So the sleep, a happy home environment, the love is very important. The other thing, of course, now with the COVID, everybody is increasing in screen time. And I think we are trying to, I'm sure in recent papers also you have read about it, that screen time need to be reduced as much as we can. Now, especially in children, they should not be exposed to screen time, as there's an AAP guideline. All right, the AAP guide means American Academy of Pediatrics. This is a guideline for children, no screen time before 18 months. Because somehow parents tend to just on the screen when they have to do their work, the child is noisy, and they just leave it to the screen. It's something very addictive. It's also bad for the eyes. And because when the child is addicted to the screen, they become lazy, they don't go out to play. This will cause obesity as well. And they may just be munching and eating, and all this cause downstream problem. So the AAP guideline, no screen time except for video chatting in less than 18 months. Between 18 months to 2 years old, select it and watch with them. 2 to 5 years old, try to reduce it to less than an hour. And beyond 6 years of age, balance screen time with sleep, social and physical activities. And for all of us, we are all culprits because the screen is so important. But there's a new disease called neck text. Okay, nowadays everybody is looking at it. They're causing stress to the spine, the neck area, because of cervical spine. Even children as young as 7 years old are getting cervical problem. That's the way, because they're looking at the screen all the time. So you really have to look at the screen. You must make sure the screen is at a higher level and not flexing your neck. And they will cause downstream problem, neck pain, stress, headache, and things like that. And for all of us, we are advised to avoid all screen, be it tablets, be it computers, at least 30 minutes before sleep, because otherwise our quality of sleep will be affected. And when you don't sleep well, you're not recharged. The sleep produces the calming hormone, which is melatonin. And you need melatonin to calm you down, to have a good sleep and to be recharged the next day. Okay, so reduce and neutralize stress in school, at home, because as I said, the cortisol hormone that's produced from stress actually weakens the immune system and predisposes you to diseases. So in children, instead of screen, we encourage you to go out to play. So that exercise your limbs, that gives you vitamin D, which is natural from sunlight, but the lack of vitamin D is a real thing in our environment and in our society nowadays. Because vitamin D is a hormone which is very peculiar. It's produced mainly in the skin with exposure to the sun. But because of the lack of exposure, we are all working indoors and people using sunblock. We find that a lot of our people in Singapore, be the adults and the children, when you do the vitamin D assay, they're very deficient. And vitamin D is not just for bones, bone health is for immunity as well. So we find that when we lack vitamin D, you're also more prone to diseases like gastrointestinal diseases, respiratory diseases, and you have to enhance it. You can take it supplement, because there's very little food that contains vitamin D. You have to go out to the sun to play, or you have to supplement it. So the main food that contains vitamin D are fatty fish, egg yolk, mushroom. Your supplements, which is available. The other thing that's important is zinc. Zinc also improves your immunity, and zinc actually comes from seafood. Zinc comes from nuts and seeds, all right? So zinc is important. It helps in the white blood cell to produce antibodies. Deficiency in zinc, deficiency in vitamin D also cause increased risk of respiratory infection, especially the lung infection, and diarrhea and vomiting. Zinc and the other vitamins, which I think most of you know, vitamin C will cut down respiratory infections. Vitamin A will reduce lead deficiency, will cause diarrhea. The B complex, which is important to be added in as if you're a vegetarian diet. Iron is also very important. Babies who are breastfed, remember to check iron when the baby is about 4 to 5 months, because iron is low in breast milk. And the iron store that's present in babies usually get deficient by 4 to 5 months until you start your iron fortified minerals or iron in the diet. So if this iron is low, it affects the cognition as well as infection. Risk goes up, so iron can be supplemented as well. Probiotic is something we add into your diet if you are not breastfeeding as well. Besides taking formula that's fortified with probiotic, some probiotic supplements advocated by pediatricians, and there are different type of brands in the market. To check with your pediatrician which is the best for you. Okay, so in order to be strong and healthy, you need to have a balanced diet in order to be healthy. And you're healthy, then you have the energy to go out to play, and you're able to eat well, your brain functions well. That's when you become smart as well. Okay, so it's a combination of all these aspects. I don't think there's a specific food that you can take just to strengthen the respiratory system. This food about giving food to the mother, whether the maternal diet affects the outcome eventually. I think basically it's just healthy diet. So you make sure your diet is well balanced. Of course, I think most mothers nowadays do not take food which is processed. I would say that's bad for us. I think basically we try to avoid processed food. Make the vitamins that all the multivitamins that your gynae give you. Folic acid is also very important because folic acid is important for strong spinal system for the baby. Previously, they think that if the child has got history of allergy, you try to avoid allergenic foods in the mother. But again, recent studies finds that it actually makes no difference. So it doesn't mean that you avoid seafood in pregnancy. Your child will not get allergy to seafood later. So there's no link. The recent study says eat whatever you want to eat as long as it's healthy. And of course, adequate rest and adequate multivitamins for balanced diet is important. So no specific diet, healthy diet. So the thing is that I think basically you just have to eat healthy, a balanced diet. The gynae will give you the fish oil, the multivitamins, folate, and some gynae also give probiotics. Enhance the bacterial flora in the breast milk and the genital area. That helps to enhance the immunity in the baby. If you are the first 6 months of life or first year of life, you try to breastfeed first choice. So previously we say, okay, you don't want allergy, you want to avoid allergy, you avoid food. So we are taught to avoid eggs, avoid the allergenic food, like we avoid nuts and we avoid honey and things like that until much older. In order to enhance to prevent this allergy, they come up with this new concept. Study shows that. It shows that if you start the allergenic food earlier, you develop tolerance. So you are encouraged to start it early. So if you're allergic to peanuts, you may want to start peanut earlier rather than avoiding it. Your body develop a tolerance to the thing so that you don't develop allergy, and it gradually increase it. So there's a whole concept of changing approach to the whole system now. I think number one, the child is doing this because you introduced it too early. And I think the problem is that maybe parents are more aware that it is a problem now. So previously, when this gadget came into it, people think that they can expose the child to a lot of the YouTube learning, exposing them. They learn the songs, they watch the cartoons inside, and they can have peace to do their work. Now, once the child sees it, it's very difficult to stop. And you should actually, so number one, you must start it right. Once you start it wrong, it's very difficult to reverse. And then you have to cold turkey. That's why we have to send some for actually management class, okay? Because we did throw a temper tantrum, they'll scream, they'll fight, and then they will just kick out fast. So number one, avoid. So as I said, first 18 months, no screen time. And that's how strict we are with my grandchildren as well. It's very easy. Once you introduce, there's no learning curve. They are very fast at it. You say that this little thing came out, and then they see pictures, they can listen to music, they can touch here, touch there, and then something that you don't even need, like we learn maths, we learn and learn and learn. But the screen is such an easy thing, and they're getting hooked to it is so easy. So number one, avoid it. All right. Number two, when you start it, it is mainly for a purpose. Okay. So you say communicate with your grandparents because you're not living together, FaceTime. Then as the child grow older, you may want to say half an hour just to have a program, and then go and sit with them to do it with them. Not let them have it. A lot of time parents, I find that they just leave the mobile to them and they do their own thing. And that's when they free flow, they'll just touch and touch. So number one, delay it, control the amount of time. And really there are cases where actually they need help and they do see the psychologist. I think once the child is saying, we put them to bed, I think basically 9, because I think it's a good habit. Because when the child goes to sleep, parents have a work to do. I'm sure most parents have to have their own work to be done. And the child can sleep from 9 until the next morning. Some children will wake up at 5, some children will wake up at 6, some children will wake up at 7 or 8. And I always tell parents, do not disturb them. Let them wake up on their own. And when they wake up, then you for breakfast or the meal. All right. So let them have it. All right. So it is a good habit, because eventually as the child goes to school, they have to wake up that period. So by the time they say they must go to sleep and they wake up at 6 o'clock, 7 o'clock, the school bus comes to send them to school. But if they sleep late, then in the end they have to wake up late. This will disturb them when they go to school. And then again, there's a lot of adjustment period. So I think bringing up the child correctly right from the word go is very important. So